Hi, good afternoon. My name is Miguel Matute, and I'm an occupational therapy student from the University of St. Augustine, Miami, Florida. And today I'm going to be demonstrating how to take vital signs on my patient. For the purpose of the video, I'm going to start washing my hands. I'm going to go over the 7 steps. So I'm going to rub the palms of my hands. I'm going to interlace my fingers. I'm going to scrub my dorsal of the hands. I'm going to do the fingers individual circles. One hand, go the other hand. I'm going to rub the tip of the fingers on the palm of my hands. Peel on my nails really good. One by one. Go on the other hand. I'm going to circle my thumbs, each hand, and I will finish it up with the wrist. So second, I'm going to ask my patient about her name and her date of birth. So here's my patient, and I'm going to ask her, what is your first, last name, and date of birth?
Okay, my name is Lucy Tavares. My birthday is December 1975.
All right, so having that information, what I'm going to do now, I'm going to double check. My patient should have already a bracelet. So I'm going to look for a bracelet and make sure that the information that she's giving me goes with the information in the bracelet. So I'm going to check for the bracelet. And I see the name matches with the information and the date of birth. So what I'm going to do now, I'm going to explain my patient about the procedure and the things that I'm going to do step by step. So first, I'm going to take the occlusion point. Second, I'm going to take your blood pressure. Also, I'm going to take your pulse, and then finally your respiration rate on that order, if possible. Before I start, it's always good to ask your patient about informed consent. That means that I'm going to ask you for permission, to perform all the different tests. Is that okay? Can I
Sure.
proceed and do it?
Sure.
All right. So for the occlusion point, I'm going to have my blood pressure cuff. These two strings are going to be hanging down because I'm not using the stethoscope right away, because this is for later for blood pressure. This is just for occlusion point. So I'm going to have this. My patient is going to be sitting here. Her arm is going to be slightly flexed at approximately, I would say, about a 90-degree angle, right? Make sure the arm is about heart level. And then I already asked for consent, so I don't have to do it again. So for a better comfort, I'm going to have this pillow right here. I'm going to place the pillow underneath her arm, right there. So I'm going to go ahead and place this above the cubital fossa. Here's the cubital fossa, so I'm going to place the blood pressure cuff a little bit above the cubital fossa, not so tight. These two arteries right here, they should be pointing down to the artery, brachial artery. So let me just tighten it a little bit. There you go. So I'm going to tighten it. So make sure this goes to the brachial artery. We're not using this, but I can't do anything about it because it's already attached to the cuff, to the blood pressure cuff. So this right here will give me a reading, right? So I'm going to place this on my patient's shirt. So I have permission already, so that's good. I'm going to go ahead and palpate the radial artery, which is located medial to the styloid process. So with the two fingers, not with the thumb, but with the two fingers, I'm going to look for the radial styloid process. I'm going to move medially 2 centimeters inwards. That should be my radial artery. So I'm going to feel the pulse, and then what I'm going to do, I'm going to tie the valve right here. I'm going to tighten it up, and I'm going to inflate it. This right here is going to give me a number. So whatever that number is, I'm going to add that number to the actual blood pressure. It should be anywhere, when I do the blood pressure, it should be like 20 to 30 millimeters of mercury of whatever, that reading comes up. So here, this is done in a way that whenever I'm not longer feeling the pulse right here, that's the number. I look for that number. So I'm gonna go ahead and inflate it. So here my number was 80. And I'm gonna go ahead and deflate the valve slowly. Ideally, once you deflate the valve, you want to wait 60 seconds if possible before you take the blood pressure. This is just the occlusion point, so that was fine. So I'm gonna lift that on my patient for my blood pressure, but now I'm gonna use this scoop right here. I'm gonna go ahead and clean it with sanitizer. I'm gonna place this on my ears right here. So remember, I have an 80 here, right? So if I did have an 80, that means that I have to inflate this 20 to 30 millimeters of mercury above that reading. So that will be 110. So I'm going to close the valve right here. So before I do that, I'm going to palpate for the brachial artery. The brachial artery is located on the cerebral fossa. So I'm going to ask my patient to bend her elbow slightly. And once I feel the tendon of the bicep brachialis, that's where my brachial artery is going to be located at. So I add it. Make sure that cystoscope is located here on the artery, so I feel the sound. And then I'm going to go ahead now, like I said, inflate it. It'll be about 110. Deflate it. So my first sound was at about 100. Last one gave me 60. So my patient has 100 over 60. So how this is read? 100 millimeter of 100 over 60 millimeters of mercury. So when you're writing that down, you have to make sure you put less than 100, less than 60 millimeters of mercury, right? So you write it down on the paper. That will be my patient's blood pressure. Now, I gotta tell my patient that she is within functional values, because normal blood pressure will be anywhere from 120 to 80 millimeters of mercury. So also I'm gonna instruct my patient or give her some little education about blood pressure reading. So anything above 120 and 80 would be hypertension. The cause of that could be genetics, it could be bad nutrition, it could be stress, medications. So at this point you have a pretty healthy reading. So I'm going to go ahead and remove everything, and I'm going to do the pulse and respiration rate on my patient. So I'm going to go ahead and remove everything right here on the table. And then I'm going to do my pulse. So with the pulse, similar, but I'm only assessing for the radial pulse. So we already know where the radial pulse is located, right by the S-alloy process immediately 2-3 centimeters immediately with my fingers. So I'm going to get the feeling for the pulse, and I'm going to count this for 30 seconds. What is the number I get, and multiply that times 2, and that would be my patient's pulse. So a good pulse would be anywhere from 60 to 100 beats per minute. Anything high will be abnormal. Lower will be fine. That makes my patient heart is working efficiently. Maybe my patient is an athlete. So I'm going to go ahead. So relax your hand. 30 seconds. I'm going to count. Alright, so I have 36. 36 meaning that we take that number and we multiply the number times 2, and that will give me a 72. So at this point she has a 72 pulse, which is really healthy for her age. And then I'm going to go ahead now do the respiration rate. Respiration rate. Same technique. I'm going to count 30 seconds. Whatever number I get, I'm going to multiply that times 2. Normal functional values for respiration rates for an adult would be anywhere from 12 to 20. So the way this is done, I'm going to place my hand on my patient's upper chest region by the clavicle. And again, I always ask you patient for consent. Is that okay?
Sure.
So she will start breathing. I want you to start breathing normally, so just relax. Nothing's going to happen. Go ahead. So, alright, what I got here was a 9. And then if you take that number and you multiply that number times 2, that will give you 18. So my patient is, she is within normal values for her age. She has 18. Normal values were anywhere from 12 to 20. That's it for the video. Thank you for watching.